Pharmaceutical giant Mylan making headlines for the skyrocketing price of their Epipen product, more than 400% since the acquisition of the device in 2007. It's a life-saving emergency drug, and it's being sold for $57. It was being sold for $57 back in 2007. That same device now costs consumers more than $500 and $600 in some cases. Parents are outraged, including Jeffrey Lederer, the parent of an Epipen user who slammed Mylan's price hike.
It's outrageous what Mylan has done with this drug. There's been no technological advancement. There's been no advancement in any area.
They haven't had to invest, so they can't justify a price hike.
There's been no investment. There's no justification. I'd be the first person to say that its competitive advantage exists, but I believe that this is pure greed.
Joining me now with this is metropolitan pain medicine doctor, Dr. Devi. What do we need to know about this? Because it's very scary for parents who won't be able to afford that their kid needs it.
Sure. I mean, it's the worst kind of scenario because you've got something that's life-threatening, a deadly condition. You've got a drug that is safe and effective, right? So the ideal situation where you could save someone's life. But then these parents have to fork over so much money to be able to ensure that their child is going to be okay. I mean, adults, too. Anybody can have anaphylaxis, which is a fatal allergic reaction.
Why is there no generic competitor?
There is a generic competitor. It's called Adrenaclick, but the issue is that a lot of people don't know how to use the generic version. It's slightly different in terms of the way the device works. So your worry is that, let's say that you're having anaphylaxis or your child is, right? What if the people around you don't know how to use it, so they can't figure out that click mechanism? You don't really want to gamble where your life's in danger and the people around you aren't able to do it. I mean, if you're in the hospital, doctors can also actually inject epinephrine. They can draw it up in a syringe just to inject you with a needle, but there are a couple things to be careful about. You can only inject in the fat. You don't want to inject in a blood vessel. Exactly.
All right, so they've got a monopoly on this particular product, which they purchased. Do you see anything wrong with the way they're handling that?
I do, because it's not as though they're spending more money to develop the actual device or the drug. I mean, the drug itself is probably less than $1, the epinephrine. The device, it's fair to say they have a great product, but it's not that they developed it in a vacuum, right? Other patients, the medical community, people have helped them to actually develop this device, in the form of clinical trials, patient volunteers. All sorts of people have an investment in having this drug and device be effective.
So the device actually holds $1 of the actual medicine, and they're selling it for $600.
But I want to point out, your average patient would have insurance coverage. They wouldn't pay $600. They would pay somewhere below that amount of money, right? I mean, the numbers I saw at the very highest, based on a high deductible insurance plan, it might be $400, which is still a lot of money, but nevertheless, and this is not something, to point out, it's not something you have to take daily.
No.
It's to have in case of an emergency.
Exactly.
So it's not a recurring cost, potentially, if you're careful.
Well, it is a recurring cost because the drug only lasts for a year. So the device expires, so you'd have to, repurchase it every year. Plus, it's only sold in a 2-pack. So you can't just buy
and
one in isolation. Well, and you'd like to have it in different locations.
Yeah,
kids, you got to have it at home and at school, and perhaps
if you have insurance coverage, it wouldn't be $600.
It depends. So different contracts, people, wholesale versus retail is different prices, right? And then with certain insurances, you might have coverage. But what happens is, let's say you're generally healthy or your kids are healthy. This is a practical thing, not necessarily because of Mylan. You might buy a high deductible insurance plan, right? Because otherwise you're doing pretty well. So then you might actually see higher costs than if you were very sick and had a premium insurance plan.
The company has issued a statement to Fox Business saying this: with changes in the healthcare and insurance landscape, an increasing number of people and families are enrolled in high deductible health plans, and deductible amounts continue to rise. This shift has presented new challenges for consumers, and they are bearing more of the cost. Okay, so they just kind of spelled it out there for us.
That's a practical issue. That's true. But still, the price hike, like you mentioned, from 57 to above 400 or something in that range, that's a huge change, which is actually, not necessarily based on developing the device, their cost.
Is this going to encourage more competitors to come in?
They had a competitor, Sanofi, which then voluntarily recalled its product. So I think that's why they have almost a monopoly in terms of this type of device. But hopefully other competitors will jump in.
All right, and David had a question. Why are there so many more allergies now?
Yeah, so I mean, I'm not sure. Part of this might be related to more awareness that people actually know about it. Some of it, I mean, there are a lot of factors that affect people's immune system. So we're seeing more autoimmune disease. We're seeing a lot more allergies and anaphylaxis. So it's not totally clear why that's happening yet.
That's a study worth doing.
That's true.
Okay,
No,
David.
it is. That's a study worth doing. When I went to high school, we didn't have, kids with peanut allergies.
No, you probably did.
But maybe people didn't know.
Well, nobody died in my high school because they ate a peanut, and there were lots of peanuts.
It would be the
peanut
best.
butter was a staple.
Well, you're right that the best solution to this problem is to figure out what's causing it and treat that, right? Not necessarily the medication. But until
I'm a foundation problem guy. I want to find out why
It can be a
exists.
very scary thing for these parents who have kids. They realize they have this. All right, Dr. Devi, thank you very much.